All right, well, nice to meet everybody. Like Kristen said, my name is Mark. I'm from the Farmacy. We're a medical marijuana dispensary. We're located up in Traverse City area. Right now, we're currently doing deliveries throughout the state. So even though we're up there, you don't fear that you have to drive all the way up there to see us. And there's other dispensaries in the area too that may have similar products that you'll be able to find at their locations. So a quick history about me. I got into the medical marijuana industry in right around 2008, 2009, right when the law first got passed. Had never used medical marijuana previously. My first time experimenting with it was about 24, 25, and then didn't really mess with it until I broke my hip. I broke my hip playing football, and I found that I get a lot of relief through medical marijuana for my hip, arthritis, all other kinds of ailments that, typical folks get. So, but we're here today to talk about your special needs kids. And it's really near and dear to my heart when Beverly brought it up to me. I grew up in northern Michigan, and I had a cousin that had cerebral palsy. He and I were best friends growing up. Unfortunately, we're the same age, but unfortunately he passed in the year 2000. He was 32. He aspirated in his sleep. So your kids, I have the opinion that a lot of the kids with cerebral palsy are true angels. They never have to judge anybody. They don't get judged themselves. They do get judged themselves, but they don't perceive it, which is very fortunate for them. But I'm really happy to be down here. I think that you'll find that going through this program that there's going to be all kinds of benefits to the cannabis plant for your specific needs. Now, every child is different, every person is different, so what we're going to talk about today are just guidelines and understanding of the plant and the process and how everything kind of works. We'll touch on a few specifics about different conditions and how we can get children incorporated into the program, because it's very sensitive when you're working with kids. You try to introduce them very slowly to the program. We do that for a couple of reasons. Number one, we want to find out if what we're doing is working. To begin with, we'll see certain signs that we look for when we're working with kids to try to get them better acclimated to the product. Primarily in cannabis, so I guess we'll talk about first the couple different, there's actually three main components to cannabis. Sativas and indicas are the two separate varieties of cannabis plants, right? The sativas wake you up in the morning. It's more of an uplifting. We use that to treat ADHD, PTSD, depression, anything like that. Anything that's going on with the brain or psychologically, we try to use sativas because they're more of an uplifting plant. The indicas are the opposite end of that spectrum. They put you to sleep. They are really good for pain relief, for nausea, for stuff like that, and will put you to sleep at night. So what we do with the sativas is we wake you up in the morning with the sativa, which gets you energized. Like I said, for my ADD, I have ADD, and it helps me manage my whole day. It lets me organize everything correctly. And then the THC, that's how we turn the lights off at night. So in the morning, we turn it on with the sativa, and at night, we turn it off with the indica. What you guys are talking about and what we're going to focus on today are CBDs. Now, CBDs it's called cannabinoids. And what cannabinoids are, we have them already present in our system, right? They're part of our what's called the endocannabinoid system. So what that is, it's like if you picture an electric grid all over my body that's just under the skin, that's my endocannabinoid system. And we produce cannabinoids naturally on our own, right? But what we use the plant for is to boost those levels in individuals. So we can activate those endocannabinoid receptors and actually help with so many different types of functions. I pulled some references up here. So the cannabinoids receptors are stimulated in a variety of psychologic processes. Researchers have identified two cannabinoid receptors, CB1 predominantly present in the nervous system, connective tissues, gonads, glands, and organs, and CB2 is predominantly found in the immune system, and it's associated with structures. So there's two types of receptors, right? One is associated with pain, the other one is associated with processes. So if you have a child that is, say, more in pain than they are affected by a process, there's going to be certain cannabinoids that work well for that individual versus if they have a process issue where they have a hard time functioning or some cognitive issues, the other cannabinoids are going to work well for that person. So when you look at cannabinoids, there's a myriad of them. There's over 1,000 different compounds that are available in cannabis. But the CBDs, what they've done is they've grouped a lot of the CBNs, CBGs into a CBD, right? So CBDs are going to primarily reduce inflammation, right? That's one of the benefits of them. So not only does it reduce inflammation like in your elbow for swollen joints, but it actually reduces inflammation in your whole body. And you're talking about capillaries, all your arteries, all of your veins, wherever their blood needs to go, it will reduce the inflammation in those capillaries so the blood can get where it's going, especially in the brain when we're talking about all the small capillaries that are up in your brain. So for cognitive functions, CBDs work really good, and at certain levels, they will work. They will never. You can never overdose from CBDs, right? You can't get too many of them in your system. So what I recommend is when Sarah and I are working with patients, is we try to get your body built up with as many CBDs as we can, right? So that way when your body's looking for something, looking for that CBD to fix that nerve or to put in place into that endocannabinoid system, it's available, that you're not looking for it. So what we'll do is we'll start off something with a really low dose and then see how they react to that. And then we'll get the patient up to a plateau, to where we're right where we want to be, and we want to level that system out. So then we'll stop the dosage there and keep that as our consistent dose, and then span that out for a period of time just to see how they're reacting to it. With Skylar, he works really good. Bev's, the patient that I'm working with, Bev's son, or grandson, I'm sorry. Son, all right. So what we want to do is to go in, we went into it slowly. We found a dosage that works really good for Skylar, and he's been continuing that ever since. His seizure activity has dropped down to almost nothing, and it's really encouraging to see kids get their functionality back and all of that. One of the keys to when you're working with cannabinoids is to make sure your diet or the patient's diet is right. We want them plenty hydrated with a lot of electrolytes. Pedialyte helps really good with that. Smart water, something that's charged with electrolytes is good to get them to drink, because what that does is if you put a toaster on the floor, it's not going to electrocute anybody. But if we're all standing in water, we're all going to get electrocuted, right? So our body works the same way. If that person is dehydrated, the cannabinoids are not going to work as well. Everything shrinks down and becomes really constricted. So by getting them hydrated and getting that system fully functional, by injecting or inserting CBDs into that system, they can then travel wherever they need to go along that same electric current that all of our nervous system travels along. So that's how it works. And once it goes into your endocannabinoid system, it looks for places to repair. So just like there's a break in a electric grid somewhere and you don't have power to your house, the same thing is what those CBDs are going to do, is they're going to help fix that repair that grid. So I explain it to folks. If I had a whiteboard up here, I'd draw it. But if you picture a light bulb, right? The filament's connected, everything's working, light's working fine. But when that filament burns out, what happens is the light doesn't work. Electricity that's flowing to that light can't connect that circuit. And the same thing that happens with us, right? So if we have, like say for instance, Sarah has diabetic nerve pain. She gets a lot of tingling in her legs. And that's from those damaged nerves that either got damaged through an event, a physical event where they get cut, or dehydration event to where you become so dehydrated that your nerves become brittle and don't function properly. And what happens is the cannabinoids will travel down that endocannabinoid system, and when it gets to that light bulb, it'll notice that it's not firing. So a cannabinoid, a little CBD, will go and place itself on the end of that filament. Same thing on this one. And then what happens is it builds a bridge, and all of a sudden there's a connection again. And that happens in your brain, that happens in your body, that happens wherever there's nerve damage, and you have a CBD receptor that can help repair that. The same thing goes with your white blood cells. If you've got some white blood cell damage or you've got a low white blood cell count, cannabinoids will actually help increase those blood cells by reducing, it's a certain compound that's on the outside of those cells that cannabinoids will help disperse, so that way you can absorb the cannabinoids. So I'll just read you a couple bullet points here from the research. This speaks specifically about cannabinoids. So cannabinoid receptors located throughout the body are part of the endocannabinoid system, like we talked about, which is involved in a variety of physiological processes, including appetite, pain sensation, mood, and memory. Cannabinoids receptors are a class of cell membrane receptors under the G protein coupled receptor superfamily. If that makes sense to anybody. Then the question is, how do CBDs work? CBD inhibits the FAAH enzyme, a compound that activates the CB1 receptor. By doing so, CBD minimizes the activation of CB1 by THC, reducing its psychoactive effects. The activation of adenosine receptors by CBD gives the anti-anxiety, which is what you're talking about, the anti-anxiety and anti-inflammatory effects of cannabidiol. So that's what your CBDs, so starting off right on CBDs may lower that anxiety level enough to where it's not, maybe just take the edge off, you know, and then we'll work on the meat of the problem, but that might just take the edge off enough to where you can get some relief from the episodes, and him the relief from the episodes too. And then this question is, where are the CB1 and CB2 receptors located? The CB2 are mainly found in the white blood cells, in the tonsils, and in the spleen. The immune cells also express CB1, although there are fewer of them than CB2 in the immune system. One important function of the cannabinoid receptors is the regulation of cytokine release. I don't know what cytokine is. But yeah, so if you just go on, what I would suggest is get on Google and just start researching cannabinoids, CB1, CB2 receptors, and there may be something in that research that turns a light on for you that's not going to for me. And then once we have that light turned on, we can then talk about what we can do to customize a treatment for your patient who you're working with. So autism and Asperger's are similar conditions, right? So where they have psychological impairments to where they don't function in reality like the rest of us do. So that comes from that short circuit that I'm talking about, right? Like the blood flow is trying to get to the parts of the brain that have either been damaged by some type of either disorder at birth, something they develop later in life. So when we're treating those, we want to treat them in the same way. Diet is key in getting those cannabinoids into them. So that way when your brain, when all the swelling in your capillaries goes down, the blood is able to reach and stimulate more parts of your brain than it had before. So what happens is a lot of folks will, I don't know, it's an enlightening, I should say, for lack of a better word. So like I think Skylar had a really good experience on it, to where his attitude was a lot better. He was a lot more, I'll let Beverly talk. He plays a lot more. Yeah, his attitude's a lot better. So that's what it does. So those dormant parts of the brain that haven't been stimulated because of whatever disorder, these cannabinoids are able to force their way in there and actually get to that part, reduce the swelling, allow the blood flow to get to that part of the brain, and allow the oxygen to get to that part of the brain. So it actually helps stimulate everything up, wakes everything up, right? So CBDs and THC work in tandem. With Skylar, what we had is we have a low-dose capsule that we try to give them, right? So that way he doesn't have to ingest anything smoke-wise. And we have a lot of different products that we can get to you: candies, suckers, capsules. We do a Chex Mix if they're diabetic and they can't have sugar. So getting it to them on a regular basis is great. To keep the repair mechanisms, the CBDs, in their systems, so that way, when, like I said before, when they're available, that they can readily access them. Let's see. And that was the sativa portion of it. And we start with a really low dose for kids. We've designed it specifically for kids, so adults can take them and they won't feel anything at all. You know, it's a very small dose, because it's our opinion that THC and CBDs work in tandem. So what THC does, THC is the nerve stimulant of cannabis. That's what people, when they say they feel high, that comes from the THC aspect of it. That's the psychoactive ingredient in cannabis, one of all those compounds that I talked about.